Well, thank you, Mr. Chair and Ranking Member Murray, for having this hearing. Thank you all for being here. I had the great good fortune of having a grandfather who was a pediatrician, and he practiced medicine from 1921 to about 1985. And my childhood was filled with his accounts of the changes that he saw on the medical landscape over the course of his career. I still remember him describing what it was like to see somebody suffer from lockjaw, which is tetanus. The jaw locks, the swallowing stops, the breathing stops, the muscle spasm. And his talking about what a difference it made when the tetanus vaccine became available. I remember my mother, who had 3 children, youngest one born in 1960, remarking during my childhood that now that there was a vaccine against rubella, German measles, pregnant women didn't have to worry nearly as much about going out of their house during pregnancy, accidentally contracting German measles, which could be so damaging to the fetus. So I think it is incumbent on all of us to remember these stories, because to a number of you have made the point that without this experience of what these diseases actually do and mean, we have gotten less vigilant as a society about the importance of this, importance of vaccinations. Dr. Omer, I wanted to follow up with you. You talked about the importance of work you're doing on helping pregnant women get vaccinated. We know that in the United States, almost all vaccines are administered to infants once they are at least 2 months old. So for the first 2 months of their lives, infants rely on the antibodies of their mothers, the antibodies that moms transfer during pregnancy to protect them from preventable diseases or viruses such as the flu. We know that vaccines like the flu vaccine currently available, not necessarily the new ones you're working on, are critical for pregnant women and their babies. And we know that these populations face a greater risk of complications due to the flu, including premature birth delivery, hospitalization, or in severe cases, death. But astonishingly, only about half of women receive the flu vaccine during pregnancy. With infant and mortality rates reaching startling numbers in the United States in recent years, it's absolutely critical that we take basic steps to help protect women and babies during pregnancy and childbirth. Dr. Omer, what do you think is the leading cause for the low number of vaccinated pregnant women, and what can we do moving forward to help improve these numbers and keep mothers and babies safe?
So there are several causes, and there are only few women who are outright opposed to vaccines. And there's this huge gap, this huge group, which is the fence-sitter group. Right. And so that's an opportunity to persuade, to educate, to have these meaningful conversations. So in terms of how to intervene, so we proposed a model called the P3 model. It's practice, provider, and patient. We changed it to the third P to pregnant women because pregnancy is not a pathology. Right. It's a very physiological state to be in. And we advocate for, and we are evaluating strategies, and there's emerging evidence that there is promise to this strategy, to work with the practice, for example, things like standing orders, which use behavioral economics type concepts to nudge a practice into vaccinating, working on the supply side issues, working on physician communications, and persuading pregnant women. In terms of the specific reasons, there is this focus on the baby. And so we have found, this is one of the other universal things, that mothers are both motivated to protect the baby and scared to harm the baby. Right. And as we generate safety evidence, which is very robust for influenza vaccine, we need to find better ways and evidence-based ways, as I alluded to communicate to pregnant women as well. Okay.
Well, thank you. And maybe what I'll do then, just with my limited time, is also ask Dr. McCullers, as a practitioner, I'm curious about how you go about communicating with parents who are having vaccination hesitancy. Among parents who choose not to vaccinate their children, what's their most common reason? And moving forward, what can we do to really help ensure that parents are educated about the importance of vaccinations?
Yeah, it's interesting. 10 years ago, there was one common reason, and that was the fear of autism and these bad things. Right now, there's really a polyglot of reasons. They have all sorts of different minor concerns that come up. And so the most important thing for a pediatrician to do, or a family practitioner or an OB, is listen,
Yeah.
understand, respect what those concerns are, because they're different for every person.
Right.
And then really individualize how you're going to approach that and what education you're going to give, because there are a lot of concerns that are floating around out there, and we need to have an individualized message. So it's that rapport between the patient and the physician.
And a sharing of best practices, I would expect, among professionals about how to do this.
Absolutely. Directed at what their particular concern is and
Right.
what that best practice is.
Thank you very much, and thank you, Mr. Chair.
Senator